Hi, I'm Sharon Fraser, and welcome to SharonFraser.tv live in New York City. Hi, I'm Sharon Fraser, and I'm joining you from New York City, and I'm here with physical therapist Lenny Turkel, and we're here to talk about pre and post rehab concepts and exercises for your knees, hips, and backs. Thank you for joining me, Lenny.
Pleasure to be here today, Sharon.
So Lenny, what do you feel the value is for pre and post rehab for your patients?
Well, it's invaluable to a client or a patient to have some preoperative therapy when it's available. It allows the physical therapist to do a baseline assessment of what movement patterns the patient or client has developed as a compensation to their injury. This then allows the rehabilitation to start before the surgery, where they can be educated as to what they should start doing immediately after the surgery, and also prepare the body and the muscles to do the exercises before the surgery. In the long run, my experiences are that the patient will have a more quick recovery and a more positive outcome.
I really like what you said, because I personally have had a hip operation, and my rehab and my post-rehab, I had it with you, was just made my hips so much stronger. So by the time I got into surgery, which I was trying to avoid, I was so much stronger. Then when I got out of surgery, the rehab went so much, it went a lot smoother because of that.
Well, that's an example of proprioceptively preparing the body to understand what movements are going to be demanded of it after successful surgery. Muscle has memory, and the more quickly we can re-educate the muscle, even in the injured state, as to what its proper function and movement is, the more quickly then you can recover from your surgery and diminish the time of discomfort and return more quickly to full activity.
I really like what you said about movement becoming a part of your lifestyle as you have finished your rehab and you start a new beginning towards a different kind of concepts for fitness that they might have had before the surgery.
Well, it always helps to keep in mind that the surgery is not the end of the rehabilitation process, it's actually the beginning. And patients and clients should really know that it's a long-term commitment to taking care of their body and to learn how they may have to modify activities that they were once accustomed to performing, that we want them to continue with a lifestyle that they enjoy, but to proceed with more intelligence, to try to preserve their muscles and joints so they can continue with those activities for years to come after the surgery.
So you're speaking about a lifestyle change.
Yes, the patients and clients shouldn't think of the surgery as an end to their recovery. It's really just the beginning. To really have a long-term outcome that's desirable to the individual, the patient then therapist should assess what their long-term goals are, and then from that the physical therapist can develop a home program that the client can do either on their own or under the supervision of their trainer. And they have to understand that movement is for life. We don't just have an operation and end the process of healing and maintaining the body.
Thank you so much, Lenny.
You're welcome.
Thank you for joining me live in New York City. SharonFraser.tv.